All right, everybody. It is Lucky Lab 13. Today, we are going to mess around with skeletons and figure out how old an individual was. The age of a skeleton, pretty easy to determine. In fact, this picture was sent to me by my buddy. It's about 15 years ago now. He took a picture of this burial that he was excavating in Syria. So he just sent me this thing by email. He said, hey, who is this? Age, sex, all that stuff. I could pretty much determine just from this photograph all of that information. And so will you by the end of this little discussion. We're going to talk about sex. Let's talk about sex next class. But today we're going to mess around with age. Now, one of the most basic questions is, do I have a child or do I have an adult? The dentition provide great clues into the age of an individual. Now, you probably know that children have fewer teeth than adults. Their deciduous teeth come in one at a time, and they only have 20 by the time they're age 5. When they fall out, they get replaced by your permanent dentition. 32 teeth are the number in adults. Here is the skull of a 5-year-old with those deciduous teeth. They only have 2 molars, and one of them is much smaller than the other. There are just 20 teeth in the mandible and the maxilla of a 5-year-old. And teeth come in at this very predictable pattern, the schedule. So if you have the first molar that has erupted and you have a skull, you know that individual is over 6 years of age. Then your face gets a little bit bigger, there's more room for more teeth to erupt, and then your second adult molar erupts when you're about 12. This can vary slightly depending on diet, depending on sex, and depending even on the temperature. Warmer temperature individuals tend to mature slightly faster than cold weather individuals. Finally, you get your wisdom tooth, what is really just a third set of molars. When you're anywhere around 18, it can be 20, it could be 22, even 24, depending on a whole bunch of different factors. But once you have a skull with all 3 molars, then you know you have an adult. So look at the teeth. What do you see? You see that first molar just trying to erupt, but it hasn't erupted yet, so this individual is 5 years of age, not yet 6. What about older folks? Well, old people tend to wear out their teeth, especially in an archaeological context. As you look at this jawbone, the mandible, you can see the teeth are worn out to different degrees. The front of the jaw is going to be different from the back of the jaw, and here's the wisdom tooth. The third molar has less wear than the first molar does, and you can see that on the third molar, it's less worn out. And that makes sense since that first molar erupts when you're 6 years of age, and the second molar when you're 12. The third molar obviously shows less wear. But what we can do then is just determine, based on the amount of wear on the first tooth, compare it to the second, and finally the third tooth, we can actually extrapolate an exact age based on what we know about the rate of tooth wear. This is a mandible of an old timer. The mandible has some teeth missing. Not only are the teeth missing, they're resorbed, they're gone. Older individuals have this kind of puppet face where their faces sink in because once a tooth is lost, the jawbone gets resorbed. Where there are still some teeth, you still have some bone there. Older individuals have worn out teeth or none at all, and the bone is resorbed. But here's an interesting thing. This is not an old individual. This is a newborn. This is a 4-month-old child. And this child has no teeth like an old timer, but you'll notice the sutures have not yet fused. So you can look at teeth, but if it's a baby skull, a really young baby, you've got no teeth at all. So we're going to look at something called sutures, which we've talked a little bit about, that zip together when you hit certain ages. Now this is a neonatal skull, a newborn baby. No teeth, and none of the sutures are zipped together. In fact, there's this soft spot on top of the skull. It's called the bregmatic fontanelle. Baby skulls have to actually be completely unzipped when they're trying to squeeze their way through the vajayjay, through the birth canal, because the canal is smaller than the head, and these bones actually have to overlap with one another and imbricate, and the brain gets squished a little bit, but then it bounces back. But a brand new baby has a completely unfused skull. Each of the bones of the cranium are independent, and over time they'll zip together like this one. This is a 5-year-old, and you can see that They're no longer the soft spots, but this guy's still got unzipped sutures. So if you have the skull of a child around age 5, you've got the baby teeth, but you've got completely unfused sutures. Here is sutures on a 17-year-old, and the sutures actually fuse according to a fairly regular schedule. You remember the name of this suture that goes across the top of the skull from side to side? That is the coronal suture, and that fuses when you're about 25 years of age. The coronal suture here is unfused, so we know we have an individual under age 25. Now the sagittal suture is on a slightly slower pace, and that waits another 5 years to fuse at age 30. So if you're between the ages of 25 and 30, your coronal suture is going to be zipped together. It's going to be fused, but your sagittal suture is still unfused. That's a cool way that we can figure out age of death. Now this is what it looks like when you're 60 years of age. As you probably remember, bones are like a bank account for things like calcium and other minerals. And as you put things in and take them out, all of those sharp edges, all of those sutures become obliterated. You can't see them anymore. They blur away. So if you have a skull where you can't even see where the sutures were, you've got yourself a senior citizen. On the left, this is a guy with all of the adult teeth, but the sutures are still open. So they're over age 18, but because the sutures are not fused, they're under age 25. So this is somebody who's anywhere between 19 and 24 years of age. This is probably what most of you look like. And this is what somebody looks like who is your grandpappy. Good times. Okay, here's a little pit stop. You tell me the age. What do you look at? You're going to look at those sutures, and you can see those sutures are clear as day. Those are not yet fused. When they're fused, you can't really see them anymore. So this person's under age 25. That's the coronal suture. But you'll notice those teeth are all in place. If you count the molars, 1, 2, 3 molars, you've got yourself the same as what we just saw. Somebody over 18 but under age 25. We can also look downstairs. Even from a single bone, sometimes you can figure out an individual's age. When you are very young, things like your femur are broken up into separate bones. This is the condyle. It's a separate bone when you're a child, and it's going to fuse to the shaft when you're done growing. And then this is a little bit, that's the head of the femur. These things all become one bone as you grow older. And one of the nice things that we like to look at are the knees. And when a bone is unfused, in anatomy or in medicine, we call them patent. They're patent, meaning they're not yet fused. This is what it looks like in an x-ray of a kid who's still growing, and the growth plate is in between the condyle, this bit, and the actual shaft. And so the bone is still actively growing. This is the femur, this is the tibia, and so this is the knee joint. The proximal tibia. There's a quick and easy way to remember when knees fuse. Here's a nice x-ray of fused knees. This is the distal femur, and it's completely fused. Knees at 19. Everybody say knees at 19, because that's the age when your knees fuse together. Your distal femur fuses when you're 19. Your proximal tibia, the knee joint, is sealed shut. Most people are done growing by age 19. Here's a mummy, 3,000-year-old mummy, and you can see that the knees are fused. But here's an interesting thing. The upper arm, the humerus, that doesn't fuse for another year. The head of the humerus doesn't fuse till you're 20. So this guy is between 19 and 20 years of age. As I mentioned the other day when we were studying the innominates, the pelvis as a whole is in separate pieces when you're under age 13. When you're age 13, the pelvis fuses together and they become one solid bone, the innominate. Now, you can figure out when someone gets older by other bones like the femur. For example, osteoporosis afflicts people when they get older. And this is a terrible place for your body to borrow calcium. But that's what our bodies like to do. When we don't have calcium in our bloodstream, if we didn't eat it that day, we borrow it from our bones. And osteoporosis, osteo meaning bone, pores, porosis, meaning you get bones that are lighter and they kind of look like Swiss cheese. Up top, if you zoom in on bone, it's pretty dense, but folks who get older, especially after menopause, they borrow more calcium than they put back in. And so over time, we have bones that are very lightweight and are prone to breakage. When you get older, you also have this wonderful experience, osteoarthritis. Osteo means bone, arth means joint, itis means inflammation. And you can take a look at this little footage here. There's normally this cartilage on your knee joint, and it's called hyaline cartilage, a special, very slippery type of cartilage. And if you wear it away, then there's nothing to stop bones from rubbing on each other. And over time, they rub and they become irritated. Painful, yes, and really weird looking when you see it on a skeleton. So if you see something like osteoarthritis or osteoporosis on bones, you know you got yourself a senior citizen. They're very commonly found in places like the knees, the hip joints, the lower back, and also in the cervical vertebrae. Very, very common. And this is what a couple of cervical vertebrae look like when they fuse together, because the discs between them have collapsed. The bones look like cauliflower, all this weird, unsightly business that rub up against nerves, and people have terrible pain, and they have loss of motion and flexibility. That's how you know you've got an old person. There are a bunch of clues that we look at when we want to figure out the age of a skeleton. Let's take a look at this guy. Buried from Bronze Age in Syria. I'm zooming in on the knees. The knees are fused. Don't think that this bit is unfused. That's the kneecap. That's the patella. But the knees are fused. So this person is over 19. Knees at 19. All right, let's keep looking. We've got a cranium. We can look at the teeth. This picture's kind of blurry, but it looks like 3 molars, maybe? Kind of blurry. We can do better. We can look at the cranium. Those cranial sutures are fused, and I can't see them, so those are obliterated. An individual who's got fused sutures, obliterated sutures, that's an old timer. There's one more clue that I didn't show you today, but I talked about the other day. The xiphoid process here is fused. And when the xiphoid process is fused, then we know we have an individual over age 40. So we're looking at somebody with the xiphoid that's fused, with obliterated sutures, and this person is probably somewhere around 50, 60 years of age. There we have it. So what you're going to do today is take your usual quiz, and I'll ask you questions about how to figure out the age, general age categories, and then you're going to have an assignment, and you're going to have to tell me what you know and how you know it regarding the age of that individual. Okay, let's get to it. Okay.